Hello, I'm Marilyn Margolis, CEO of Emory Johns Creek Hospital. Each year, Emory Johns Creek Hospital offers an interfaith program open to all Emory healthcare facilities and the community. These programs are part of our commitment to providing excellent, compassionate, and unique care to every one of our patients and families who trust us with their health and healing needs.
Hello, my name is Timothy Park. I'm the Director of Spiritual Health at Emory Johns Creek Hospital. The topic of today's discussion will be spirituality during end-of-life care. This topic is such a sacred and holy topic. Today you'll be hearing from three Abrahamic traditions: Islam, Christianity, and Judaism. I hope you enjoy this session.
My name is Kevin Martin. I am pastor at Prince of Peace Lutheran Church in Johns Creek, Georgia. Our Christians are unified around a paradox in their belief. That paradox is that on the one hand, there is death, which is sort of our final enemy and something we wouldn't enjoy meeting. But on the other hand, the end of life is also the continuation of eternal life and reunion with family and friends. And so which end of the paradox you grab onto kind of tends to influence the way you look at the end of life process and the journey that you're in. That there's a difference between medical directives that are the sole reason you're alive and medical directives that help you live. So in other words, if the decision is something that keeps you alive, but it's the only thing that you have, the only thing that's keeping breath in your body and your heart beating, it may not be the best life to live. But on the other hand, if there is life to be had, if you are eating and drinking and sharing time with family and friends, and there is something that can keep that process going for you and allow you that extra time with loved ones, then it would be a welcome change. If we focus too much on death in an unhealthy way, we tend to fight it, almost like a swimmer trying to learn for the first time and fighting water. And it becomes very difficult, and we resist and fight. And it also makes things difficult for our loved ones around us, too. Makes that goodbye process very hard. On the other hand, you can also tend to focus a little too much on the forever side of things and be excited about that. And in doing so, perhaps neglect some really good gifts that you can give to family and friends before you pass on into eternal life. So in 1973, Ernest Becker wrote a Pulitzer Prize-winning book called The Denial of Death. And he talked about some of the ways in which we try to deny death that end up being very unsuccessful. So one of the things that's recommended instead is not to deny death because that's impossible, but rather to find ways to defy death. And I would encourage staff and friends and family and even yourself to look for ways to do that and what that might mean, whether that's sharing creatively beyond the grave or telling good stories or even sharing jokes in the final time that you have left, something to prove that there is life and that that life has had meaning and impact on the people who are around you. So the one thing I would share, the one piece of advice that I've had that I've held on to for a long time, is that a teacher shared with me the phrase Wigiat. And Wigiat stands for, where is God in all this? And I think whatever the end of life situation, whether you're the one going through it or a loved one assisting with it or a staff member caring for someone in that end of life situation, that's always the question for a Christian. Where is God in all of this? Where can I find support and love and help? What part is he playing in the process? What part are you playing in the process to go alongside him and his spirit moving? So that's the one thing I would share with everyone.
I'm Rabbi Judith Beiner. I'm the community chaplain with Jewish Family and Career Services of Atlanta. Judaism, like lots of other faiths and lots of people, understands that while our bodies are limited, our souls are eternal. Jews along the denominational spectrum will differ in their approaches to the journey prior to death. Most people will be consumed with the medical issues during the dying process, and that once those things are resolved, people will turn their attention to the dying and, like lots of people, want to gather want to share memories, want to say goodbye, and have all of those final words together. Jews who are more traditionally observant will hold more tightly to the principle of sustaining life at all costs. When we get into questions of removal of artificial means of support, again, where you fall on the denominational perspective gives you pause to consider a rabbinic perspective. For the most part, certain guidelines that are followed on the left end, on the more minimally observant Jewish perspective, folks will follow a doctor or medical interpretation and consider issues of quality of life as opposed to just life for life itself. If you are on the traditional on the traditional end, the traditional perspective, there are restrictions in terms of you're not allowed to hasten a death, nor are you allowed to delay it. So ultimately, the ideal situation is when everything is in God's hands and that the body is allowed to die a natural death. Whenever chaplains or medical professionals are in the room, always ask the family, what do you need? What can we do for you? Prepare for folks to be coming and visiting. There won't be, many people will want their families, their extended community around them, so to have space provided for them will be helpful and important. Again, I think more than anything, ask the family if the person who is dying can answer, ask them, and let them call the shots. Disparate opinions and understandings within a family might cause distress. In addition, not having final words with the person who is dying, any unfinished business, things I think that are more that are common to all people. With regard to the journey of the soul and disrupting the soul, you know, when we die, in Jewish tradition there are end-of-life prayers, which for the most part constitute a final confessional and a statement of faith. When a person dies, hopefully those prayers have been said prior. If not, they can be said at the time of death or immediately after. Judaism considers the body as holy even after death. So when death occurs, it is appropriate to cover the body so that nobody it's a dishonor to look at the body in anything other than its being alive, in any state other than being alive. So when at the time of a death, it is appropriate to cover the body. Additionally, a family may want to observe the practice of accompanying the body from the moment of death until the time of burial, which means that a family member or a member of the community may want to stay in the room with the body until the funeral home comes to retrieve them to collect them. And in addition, I think all faiths hold this, that in the room of where there is a person who's deceased, no levity, no laughter, no singing, no levity. That an atmosphere of quiet and somberness prevail.
My name is Noor Abadi, and I am a veteran speaker with the Islamic Speakers Bureau of Atlanta, and I'm also the co-founder of the Interfaith Speakers Network of Atlanta. So Islam teaches that every life will come to an end, and that this is inevitably a very difficult time for the patient and for their family and friends. However, Islam also teaches that this is also part of life, that adversity and hardships are part of life, and that if they're faced with forbearance and with patience, they will elevate the person and their family and their friends. It will help elevate their spiritual status and magnify the reward. Prophet Muhammad taught his followers that for every disease that God created, there was also a cure that was created for that disease. Now, being able to create that balance of hope in finding a cure and hope in recovery, and between the ultimate fact that everybody is going to die at some point, this can be a difficult balance that Muslims or any other believers of other faith traditions can also have. The departure of a loved one can be a very shocking event in a person's life and their family and their friends' lives. And Muslims are not an exception to that. However, Islam teaches that this life is a transitional life to an eternal life where God's mercy is going to envelop everyone. So this can give hope to the family and to the patient, despite the very difficult and distressing situation that they're going through, that eventually this life will come to an end, and hopefully they will all be gathered in a better place. In terms of advanced directive and DNR and DNI, there's no one clear answer that applies for all Muslim families. Everybody is different. However, the teachings of the religion is that life is very sacred and needs to be preserved. But then in each individual case and situation, there are nuances, and that's why you might get different opinions and different decisions taken by each individual case and family. In an end-of-life event, this is a very difficult time for everyone, and it's almost very difficult to know exactly what to say to give relief to the family of the patient. However, constant reminders that God is here with them and that God's mercy and compassion is going to be with them and with their loved ones, this helps give solidarity and support to the family of the patient and to the patient themselves. Because illness and death are considered to be a test of a person's faith, it is encouraged in Islam that Muslims come together as a family, as a community, and show solidarity to each other. So it is expected that the family will have lots of visitors, and this is common. It's not unusual. However, sometimes the caregivers might ask the visitors to give some privacy to the family, or that maybe it might not be a proper time to have long visits. But this is how Muslims show solidarity to each other. So this is a usual thing that will happen. And it's also usual in the event of death or end of life that Muslims share prayers with each other. They exchange these prayers, again, to give support and to give solidarity. A very common prayer that you might hear in a Muslim family is, "To God we belong and to whom we shall return," or a prayer for the family of the deceased in cases of death, where they say, "May God magnify your reward for your patience of losing a loved one."